Thank you for having me. Thank you for the introduction. It's very, very good to be with you here today. I have a lot of material to cover, and I'm time sensitive, so we're going to get into it right away. One thing before I begin, though, Herta Martinez is the account executive for the Columbia Union, and she's not here, and you're wondering where she is. She sends her greetings. She is in another meeting, and since she can't be in two places at the same time, I was happy to come and meet more of you, so she sends her greetings. As we get started, I have a short video to share with you, and then we'll get into some of the topics at hand.
Hi, I'm Bob Kite, President of Adventist Risk Management. Ministry is delivered through service. So how does Adventist Risk Management perform its ministry?
Hi, my name is Jermaine Jackson. I want to talk to you about the Ministry of Risk Management. The Ministry of Risk Management is one that we all share. It is the ministry of keeping our visitors and members safe from harm. Preventing accidents protects the church's opportunity to minister. The Ministry of Risk Management is built on three principles. The first is risk prevention, where we remove the possibilities of accidents or damages. The second is risk control, where we lessen the effects of a damaging incident. And the third principle is risk financing or insurance, where we create a financial mechanism to pay for the losses that happen despite our best efforts. Adventist Risk Management offers risk management resources exclusively designed for Seventh-day Adventist churches, schools, community service centers, and their related ministries. Because we are entirely staffed by insurance professionals who are active members of the church, we have an intimate understanding of the Seventh-day Adventist ministry's unique needs.
Hi, my name is Leander Tomazelli. I work with churches and church organizations to help identify their risks. It is important to build a prevention plan that addresses the specific needs of an organization. This can include keeping track of maintenance and consistently inspecting your site for hazards.
Hi, I'm Karina Franca. I am a marketing analyst. My job is to analyze loss trends so that we can create prevention tips to help you to minimize your risks. I also organize our free online newsletter called Solutions. We provide quick tips, articles, and videos about safety written specifically for the church.
Risk control is about making the effect of a damaging event less severe. For example, when a storm breaks your windows, you want to put up a covering so that the inside of your building is not exposed to rain. We are available.
Now you're missing the best part. We're just going to keep going. The reason I wanted to share that video, it talks a little bit about the ministry we're involved in. Most importantly, in my mind, is it shares a little bit of the staff that you don't necessarily meet every day. I get to come out and meet with you. You might recognize Jermaine. We're here in the flesh. But to meet Cecia, who handles your claims, to meet Karina, to meet Leander. These are people who care deeply and passionately about your success in ministry. And they're delighted to serve in the way that they can. All right, let's talk about some business. You're wondering what's up here on the screen. I wanted to talk a little bit about ACA, the American Camping Association. Adventist Risk Management highly recommends that your camps get ACA accreditation. So to that end, we are actually going to be supporting. For those camps that have your primary core policies with Adventist Risk Management, we're willing to fund 20% of the annual fee up to $500. What we really want to see is camps with standards in place, policies, guidelines that parents can rely on, and that will definitely have a positive impact in your loss profile. So please consider it. If your insurance is not with Adventist Risk Management, consider it anyway. It's still a fantastic idea. I hope that we'll see more and more of our camps across North America making use of this. A little update to Adventist Risk Management's insurance policies. This year, after a couple years of really hard work, we have actually moved to a new system. It produces a new type of policy. Now, is the policy new as far as what's written in it? No. But the way it's put together, the system behind the scenes is new. It is a commercial package policy, so you have your property, general liability, employment practices built into a single policy. What does that mean for you? Well, it means every year you will get an actual complete policy. Over the years, you've typically gotten a policy with endorsements, and it builds over time. And if you truly wanted to look at your entire policy, you had to look through a few years' worth of papers. Well, every year now you'll get the whole package. It is many pages long. There's a great deal of detail. So why do we do this? The positives for you are increased efficiencies and accuracy. It means our internal systems working much more effectively together. One of the examples I think of is our claims department will be able to immediately and quickly in their claims system verify coverage right in the software. So that will speed that up and make that more accurate for you. Some of the things we're working on. I know you want to talk about healthcare, don't you? So we're going to go through these quickly. We have seen losses mounting across the North American division. Some of these losses could be avoided. We've explored a lot of creative ideas of how we could address this. One of the initiatives has been the idea of safety officers. Do you have safety officers in your conference? I see a hand. I don't see a lot of hands. I see a few more hands. Okay. Safety officers are a fantastic idea that I have seen not work at all in some places. In my own church, I haven't seen it work at all until my pastor decided it was a priority. Now, what does a pastor have to do with that? As it turns out, almost nothing, but in another sense, everything. Our pastor decided, you know what, safety is important in our church. If we're going to invite people to come here, we need our church to be a safe place that they can meet God and not have that experience spoiled with something unfortunate taking place and ruining it. So he said, we are actually going to take all these recommendations from Adventist Risk Management. We're going to put a program in place. We're going to designate a safety officer. And so he met with the nominating committee. They nominated somebody. That person accepted. He brought the committee together. And the pastor's role in the whole thing has simply been, we're going to get it done. You're going to do it, and you have my support. Something happened that never happened before. Leaders were leaders. They said, we're going to do this. I'm going to ask you to do it. And it got done. It takes leadership making it a priority. It doesn't take leadership doing all the work. It just takes leadership making it a priority. Our pastor isn't super involved in the process, other than to say, please get this done and make it a priority. And if we need to do a fire drill during church, we will. And we did. And it went really well. Lasted about 5-10 minutes, really. probably 10 minutes by the time we got everyone back in. That's always the challenge. But I would encourage you to partner with Adventist Risk Management in new ways. We are looking to package these ideas in ways that are easier to implement and more effective. It means having access to your pastors, though, because very little does happen in a conference at a local church without the support of leadership. We can say what we want, but until they buy into the idea of it being a good idea to do it all, I don't know that it'll go very far, very many places. So please partner with us. In that vein, emergency planning has become more and more of an issue that we would like to see taking place. Better planning, better awareness of emergency planning. And so March 26th, which is a date that might ring in your head for another reason altogether, we've designated as a safety Sabbath, and we're encouraging churches, and we'll be sharing more information about this, to participate in one of 3 different types of drills. We'll share more about that as time goes on. I wanted to share a brief note about an individual who left Adventist Risk Management this year. Many of you, I'm sure, knew Arthur Blindsey. I worked with Arthur Blindsey for, 11 years now. And he was a good friend. I usually, in all these years, reported to Arthur. And in September of this year, Arthur resigned from Adventist Risk Management to pursue work in the private sector. And so the questions that have come up to Adventist Risk Management have been surprising. Does Adventist Risk Management still do training? Will you still come do presentations for us? Absolutely. All of the services we provided when Arthur was here, we still provide. And I wanted to assure you of that, and we still continue to provide those at no additional charge. So if you have a conference, I recently came from, I was in the Mid-America Union Children's Ministries Conference. They asked me to come present on child protection. We're happy to do that. And in fact, we encourage you to invite us. If we can somehow enhance what you're doing in your ministry, that's what we're here for. My information is up there on the screen, David Fournier, and my email and phone number. Herta, who works here in your union, is there as well, and my boss, Tim Northrup. So if you can't get one of us, you can definitely get the other, but we tend to answer our phone and emails, so make use of that. Really quick, where are we going for Risk Management Conference next year? Tampa, please come. We'd love to see you there. We will start registration and all that promotional stuff in the new year, but we look forward to seeing you at that event. So healthcare. We did 2 major things at the beginning of 2015. We moved from Blue Cross, which we'd been with for several years, to Aetna, and with HealthScope. And that's the key word. It's an idea of Aetna with HealthScope. And we'll talk a little bit about the role there. And we also did another major thing. We went to a 2-plan model system, where employees, depending on the conference, could perhaps choose between a legacy plan or a standard plan. So you had 2 options. Why? Oh, I went too far. There we go. This is feedback from you. It was requested to find a plan that we could offer our employees that was less expensive to us as employer groups. And it was also in the interests of shifting costs to employees where possible and reducing non-essential medical coverages. Do you know which one I'm talking about when I say that one? Massage therapy is the one that comes up on that. This was voted by the North American Division, and this is a very separate change from the conversation of moving from Blue Cross to Aetna. Okay, so we're talking about two different things. The change from Blue Cross to Aetna and the idea of having two plans are two completely separate ideas. All right? And they happened at the same time, which is why that's a little confusing. So what happened is employer groups, can you see that really clearly? The very dark is the employer groups that offered legacy only. So they didn't even give their employees an option. They just offered legacy only, okay? And then that's 54%. 44% offered a choice, which was the idea. That was the whole point of it, where an employee could choose between legacy and standard plans, either like what they had forever, which cost a lot of money, or something that's a little less expensive. And one employer in the entire North American division offered only the standard plan, the less costly plan, the cost-saving plan. All right? So, not surprisingly, very few employees participated in the standard plan. Well, it wasn't offered to half of them, so that's not really a surprise, is it? Let's talk about the change in provider network. Wow, the time is flying. Okay, here we go. The NAD voted to move from Blue Cross, United Concordia, and another organization, WebTPA, and to move to a single PPO that combined as a PPO for both medical, dental, and everything else. And there was absolutely no change in the prescription drug company. It's been interesting. Apparently our healthcare department has had some feedback that the cost associated with prescription has changed, but that's surprising since the company didn't change or the plan in that regard. That may have just been the types of drugs that were being used by that individual. So why this change? The goal was reduced administration costs rather than have multiple organizations processing, this for medical, this for dental, this for vision. All one organization processing all of that, so you have less administrative fees and also reduced conflict and overlap in the number of organizations handling the claims, so less confusion as to who should be doing what. A few observations here. Self-insured is still the industry's lowest cost method of funding healthcare. It's been noted employees want the same or better benefits while employers want the same or better benefits and reduced costs. Would you like reduced costs? Me too. Unfortunately, you tend to have to give something in order to get that. It's a challenge. Employers who have been the most concerned on costs are not taking advantage of the standard plan option, which was designed to address that. Unfortunately, some of the loudest voices complaining about that didn't even offer that option to their employees. So hard to know what the thinking is there, but that's what happened. Cost projections. Healthcare costs are projected to increase. Someday I'll get to say decrease, I'm sure. 4 to 6% the next year. Prescription drugs are increasing by over 10%. I have a friend who went through cancer treatment this year. I was absolutely staggered to discover what they had to pay per dose. $10,000. This is a real case scenario on the screen. $10,000 a dose. The whole course of treatment, over $100,000. It kind of throws your budget for a whirl. So who are we looking at? PPO network is Aetna for medical and dental. Okay? We'll talk about the role of a PPO network in just a second. Claims and member services by HealthScope, and that's for medical, dental, and vision as well. And then, of course, you have your prescription with Express Scripts, and that didn't change at all. All right, so what is Aetna's role? Oh, please.
Because that has been a problem.
In fact, we're going to take a look at the card. I think everyone should have the very latest card. Have you received your latest card? Yeah? I received 2 copies.
I
So
don't have the newest
um,
one. I got the one that said I work for risk management.
the company that produced the cards made an error, and they used the wrong field somehow. Anyway,
I have to look
so
and
that's
see if
been
I have
corrected,
that.
I'm happy to say. What is the role of Aetna? They are the preferred provider organization, and so we get to access their pricing, their preferred pricing discounts, because we're using them as, if you're in network with them. That's the whole point of what Aetna is all about. What do they actually do for us on a day-to-day basis? Almost nothing. We just get to swim in their pool, if that analogy makes sense, right? And contracted providers are not permitted to bill a member for covered services except deductibles, coinsurance, and copay. That is as expected. We did, in our healthcare team, did some studies going into this. Geo Access study. Statistics was the struggle for me in school, so I'm not going to get into explaining how this works because I'm not the guy for that. But it was explained to me by our healthcare team. They do a standard study whenever they're talking about coverage, and especially as they were looking at going from Blue to Aetna. And there was apparently 96.9% coverage, which was pretty much exactly the same thing that we had with Blue. So same coverage as we had with Blue with Aetna. A disruption analysis of 96.3% the same. So that's a positive thing. 3.7% we could expect to say people had to go find a different provider or couldn't have a provider in network. And the discounting was competitively equal. So that was, that all made sense for us, why we moved ahead. So what is HealthScope's role? HealthScope actually does all the work every day. They provide the operational consolidation of what Independence Blue Cross used to do, United Concordia, and a company we used called WebTPA as well. They do the member services, so if you're at the doctor's office and you have to make a phone call to find out what's going on, the number on your card is HealthScope. They handle those member services. They handle the claims processing. They handle the pre-certification authorization and case management. They also provide the member portal, and the Healthy Rewards program that we were used to before is now provided through them through that portal as well. Have any of you actually signed into the portal that's available? Oh, you've done better than me, actually. That's good to see, though. And there are some new opportunities in that portal that I think you do well to benefit from. We'll talk about that just briefly in the 1 minute I have. Here we go. 1 minute 51. Here we go. Member portal. You can view your paid claims in one place. Basically, it becomes a dashboard of your healthcare experience. You can request a replacement ID card. You can set up direct bank deposit for reimbursements, and it's the health and wellness stuff. Hooray. Okay, I bolded the one of those on my own. Setting up direct bank deposit for reimbursements. This would greatly speed up the return of any monies that is owed you. So encourage your employees, yourselves, anyone to make use of that. It would improve your lives and theirs. Challenges. Getting into this process, there was a lot of work involved in transitioning in because you have all of the pending claims that are, with Blue Cross. Then we're moving into this new project, new companies. So all kinds of data needed to get moved over into HealthScope and Aetna and the whole new system. As you can imagine, there was an expectation of a whole lot of work and maybe a few bumps along the way. And that's what we experienced. One of the early problems we encountered was providers calling Aetna because it's the Aetna PPO that you're trying to make use of, but they really need to be calling HealthScope. So it was not entirely intuitive to some providers, And so that's something we encountered early on. And especially as you get onto a lab or a secondary provider, that starts to become a challenge. As you go through any of these challenges, if you're still experiencing any of those challenges, we are here to help. Our health benefits team is a fantastic team that truly cares about your well-being and wants to solve those problems. I'm hearing solutions from them on pretty much every problem I've heard described, but they can't solve things they don't have information on. Please connect with them. This is the email address for them. Please communicate to them. If you can document, even better, but communicate to them and they'll communicate to you. Thank you very much for the time, and my time is up. And thank you.